Welcome to Radio CAHS, presented by CAHS Chief Executive Dr. Aresh Anwar. Welcome to Radio CAHS.
Good afternoon. Welcome to Radio CAHS. I have to say, I'm already feeling a little anxious because Beck has put on my script that this is a 13th edition, so I'm hoping that it won't be unlucky 13. I doubt it will be, looking at our guests. So welcome. Can I just, before I start, acknowledge the traditional owners, the Whadjuk people of the proud Noongar Nation, and pay my respect to elders past, present and emerging. Today, actually, we've got a really big focus on our staff who do such an incredible job transforming the lives of children and families, with a special focus on allied health, as it's Allied Health Week. So we'll be meeting them all, but welcome to Emma Davidson, Chris O'Day, Bobbie Kavanagh, Lauren Bell and Mitch, Wylie. Welcome. We're going to be touching base with all as we progress. But just before we bring... Oh, I've been told to slow down. Just before we go and get a catch-up with Dr. Dan, I just want to touch on a number of issues. The first is that the top 10 innovations which are going forward for the Challenge and the Shark Tank have now been announced. I do want to actually reflect on the other 80, because we actually were incredibly spoilt for choice. I suppose we were reminded of the huge amount of intellectual curiosity that exists in the organisation. We had 90 applicants, and I know this is a slightly banal comment around how difficult it is to choose, but it genuinely was immensely difficult to choose. Many themes, a huge amount of commitment, and for me, one question that we really have to ask is how we change the culture to allow people to make those changes that are required in the organisation without having to go through an innovation challenge in the first place. But whilst we enable that to happen, let's celebrate some of the very best ideas in the Shark Tank. The second thing is, I suppose, on that theme is, for those who haven't had a chance yet, can I ask if you would just give some time up and go up to the Collegiate Lounge and get just a flavour of the range of work that is going on right across CAHS, the Child and Adolescent Mental Health Service, the community health, medicine, surgery, in terms of really driving change and keeping us at the cutting edge and providing children with the very best evidence in terms of the therapies that we provide. There's a range of posters. I think the number of poster presentations was 192 this year. So the symposium is twice the size that it normally is. So reflecting, I think, the dedication and the time that people are looking and reflecting on how things can be different and better going forward. So let me just thank the organisers of that. In particular, I just want to reflect on the amount of input that Dr. Simon Woods had, Professor Peter Richmond and Angela Fonseca, and also the team from TKI, in particular Paul Watt, who has helped with the organisation. So we've had Peter, actually, who I think is a natural DJ, join us 2 weeks ago, but he's turned his hand to real science. Next week it's Recycling Week, and there'll be a display outside Clinic B in the PCH atrium. So please bring your old batteries and devices and accessories which are to be recycled. Now, that is a sentence I never thought I'd be announcing on radio in my lifetime, so maybe I'll clock that. Beck, thanks very much. And probably on a more poignant point, can I remind everyone it's NAIDOC Week last week, and I think there is sorry? No, I said next week. I said last week. I've been corrected. Oh my goodness. It's NAIDOC Week next week. I think there are two things. Obviously, it's a very significant week, and I do think it's important that we pause and reflect on it. The second, I think, point of poignancy is that it was postponed from July, and I think, again, it's just a year to reflect on how challenging it's been for everyone, in both globally, nationally, and also in WA, with lots of families cut off from seeing each other, and really significant mental distress in the uncertainty that people have been facing. The events are highlighted in Health Point, so can I please ask if you just take a moment to have a look at that. So with that, I'm going to turn to Dr. Dan for us to provide us an update, but we've got to wait for a sting.
Call now on 6456 5629 or 0436 595 600 to ask a question.
Dr. Dan, welcome.
Thanks, Aresh.
Just, Dan, I don't know whether you want to ask a question or whether this week had provided you with some challenges that you wanted to share with colleagues.
I guess just sort of what I saw in the news this week, which some colleagues might have seen, was sort of a story out of Europe, particularly Denmark, where sort of there was some concern about mutations of SARS-CoV-2, and actually sort of related to some mink farms there, where they sort of farm minks for fur. And I didn't know that Denmark's one of the biggest producer of mink fur in the world, and they've got millions of these animals. And I think what they'd found was that some of these minks had become infected with the COVID virus, and that the COVID virus had changed within the minks, and then sort of some of the farmers had then caught the virus from the minks, and as a result they're going to have to sort of, I guess, unfortunately cull a lot of the minks in those farms there.
I suppose the natural question is, does that have any implications for our own pets?
Yeah, so I think this is interesting in that we know that sort of probably in the first instance that the COVID virus SARS-CoV-2 came from animals, probably from bats, but then maybe an intermediate animal host, and in that intermediate animal host, maybe the pangolin is what they're thinking, although I've not seen much on that recently, that it required the mutations that allowed it to be able to spread from person to person. So we know that certainly sort of animals can be implicated in mutations. And what we know about, I guess, animals since that initial emergence in January, February in China is that there have been cases of cats or dogs being infected, I guess domestic pets, but not so much sort of, I guess, ongoing mutations or those mutated viruses jumping back into humans. But definitely in minks, there's been some stories out of the Netherlands, and now obviously these Denmark stories suggesting that there might be something there. Although, I guess, just to be absolutely clear, the details of, I guess, exactly the nature of the mutations and exactly what they mean is not quite clear at the moment, although there's some initial reports that it looks like this new mutation might mean that the antibodies that are produced by a vaccine or the therapeutic antibodies that we might be using might not work as well against the virus, but the details are pretty patchy at this stage.
Dan, do you mind if I ask you a personal question?
Yeah.
And I suppose the personal question I want to ask you is, the borders are opening on November the 14th, and I just wondered, what does that mean to you? Is that going to change the way you're doing anything, or what's the practical implications?
I think from a practical point of view, again, I think that government are being very careful in that sort of they're not sort of saying an open border, in my understanding, to all states, and that if states have ongoing community transmission, then clearly that sort of rule for, I guess, a period of quarantine will still be in place. And obviously every single state within Australia is watching their numbers in their community transmission very closely. So I think sort of it probably won't change a huge amount in that sort of people from South Australia, the Northern Territory, Queensland, where they've had minimal community transmission, are very similar to, I guess, our situation here. So I guess it's an advantage, and I've certainly spoken to colleagues here who've got loved ones from interstate, and it will definitely make those types of things easier. And I think given the monitoring systems we have in place, I don't think there will be a huge increase in risk to WA sort of based on these changes, and certainly I think there are some upsides from this. And I imagine this is probably where we're heading towards, where there'll be free travel, hopefully within Australia, with close monitoring of the situation. And that sort of will be a little bubble, sort of a regional bubble.
Thanks, Dan. Can I, and then I suppose I just if I could turn to the research symposium, I wondered, have there been any highlights for you as a medic within the organisation in terms of the things that you've been exposed to as a result of the symposium? I don't know whether you've had any time, because you're a pretty busy clinician, that you sort of want to share with us?
Yeah, so I think it's always really impressive, I think, to see what your colleagues are up to, and certainly sort of hearing some of the highlights, the last radio show we had of the variety of I guess, research projects that are going on, and there was obviously more of that in the symposium. I think sort of seeing the collaboration between Telethon and CAHS, and also sort of between CAHS sort of and other sort of, I guess, institutes within Western Australia has always been impressive, and I think has continued to be impressive with the stuff that I saw this week. I guess personally, I went to the session sort of where Tobias Coleman, one of our new infectious diseases professors, spoke about some of the multinational collaborations in terms of setting up trials for Brace, the BCG vaccine, as well as the interferon trial that he's been involved in, was really impressive. And also Chris Blythe, our head of department, gave a fantastic talk to update on the progress with COVID vaccines. So they were probably my personal highlights. But,
and is there anything from that talk that you could share with us around the progress with vaccines? I mean, were there any takeaway messages?
I think there are a lot of candidates, and actually probably what will stick in my mind, and maybe in the mind of many people there, was that Chris's, I think, second or third slide was a picture of, I guess, our first Australian Winter Olympian who won gold, Stephen Bradbury. So if you remember, he was the one who sort of sat at the back, and his strategy was waiting for everyone else to fall down and then to come through. And I think from that sort of Chris's message was being first is not, or being in sort of first place is not necessarily the best thing, and I guess amongst the many candidates there may be one that comes from the back of the field that becomes, I guess, the strong candidate. But certainly sort of there's a range of I guess vaccines in progress at the moment, which is promising, but it may be that the first couple aren't the best. Yeah.
Aren't as effective. So you think 2021 will be a much more positive year than 2020?
I'd like to think so. I mean, it's always sort of a bit unpredictable, but I guess if anything, you have to be optimistic, don't you?
You do, especially if it's our 13th show. So that's fantastic. So if that's Dan, thank you ever so much for that update today. That's brilliant, and thank you for touching on some of the stuff.
There was a lot of report about a D614G mutation or G mutation where a particular protein had changed in the virus, and there was a lot of alarm that this could be something that mutates very quickly. But what we do know is that coronaviruses as a family don't tend to mutate nearly as quickly as the flu because they've got a proof-reading enzyme. So the usual errors that happen when viruses replicate are a lot less, maybe tenfold less in coronaviruses, because they've got this safety mechanisms which sort of, I guess, stops it from mutating as quickly. And certainly what we've seen in the old coronaviruses compared with flu, and as well as SARS-CoV-2 now with the data we have, is that it's mutating much more sort of slowly than, say, flu, which is important because I guess the reason that one of the reasons that flu vaccines aren't 100% effective is because the virus changes from year to year, and there's a lot of diversity which we have to try and predict. Whereas sort of with the coronaviruses, it's plausible that there'll be, I guess, a lot less of that movement, so that our sort of vaccines will still be effective. And I guess even with this, I guess, G mutation that's taken over, we do know that it's, I guess, maybe more infectious, but the latest sort of experiments have shown that the antibodies produced by the vaccines, which were based on the initial D sort of virus, are still effective, and the antibodies still neutralise the G virus. So it's reassuring that actually sort of it's mutating slower than sort of what the flu does. And importantly, I think a lot of the mutations are sort of random, and the vast majority of these mutations won't actually have any impact on how the virus behaves, and sort of it's quite hard to actually mutate in a way that that leads to it being, I guess, less responsive to vaccines, so to speak. Yeah.
I have another question for you. Have we seen any mutations that have affected the way COVID-19 behaves in humans?
So I guess there's obviously the concern about what we call immune escape. So I guess the antibodies from previous infection or vaccines not working against a new mutation of the virus. And I guess there's a lot of interest about mutations changing the way that the virus behaves, either making it more infectious, which we do know this gene mutation looks like it makes it more infectious, which is why it's taken over worldwide. But I guess more importantly, whether it makes the severity of disease either worse or, I guess, promisingly better. I think thus far the mutations that we've seen, the major mutation, gene mutation, really doesn't seem to be any worse or any better. It still sort of, I guess, has the same pattern that we saw initially, in that it does make a small proportion of people sort of very unwell, and actually a reasonable proportion of people will die, particularly sort of those elderly people, and that hasn't really changed with this mutation. There was one report of, I guess, a strain of virus which was slightly less severe, and that came out of Singapore probably 3 months ago, and there was a deletion of about sort of 300 base pairs of genetic material from the virus, and when they looked at the patients who had that version of the virus versus the ones who had the original version, they sort of suggested that they might be a lot less likely to need oxygen, etc. But certainly we haven't seen lots of reports about this mutation. I think it seems to have just been contained to that one report from Singapore. But I guess the major sort of mutation circulating around seems to be sort of maybe slightly more infectious, but no better or worse in terms of how unwell it makes people. I guess the interesting thing is that sort of we're in an age where we can actually do the sequencing of the genome and share it sort of rapidly around the world. So I guess these scientists who are interested in viral genetics are able to sort of follow this in real time. And it's somewhat reassuring that we're watching this, and some people are even doing experiments where they're purposely mutating the virus in safe sort of lab conditions to try and predict what types of mutations might be better or worse. And there's a lot of, I guess, concurrent parallel work going on globally, which is somewhat reassuring. Again, remembering that this virus is mutating a lot less and a lot slower at this stage compared with, I guess, our more familiar viruses like flu.
That's brilliant. Dan, you know, one of the reasons I enjoy talking to you, because once a fortnight when I go home, I can be interesting and knowledgeable, because I just recount all the information that you've given me. So whether they like it or not, they get this conversation over the dinner table. So my family are very grateful to you for making me interesting for 15 minutes once every fortnight. So thank you very much. As always, an incredible amount of really important information communicated with such clarity of thought and expression. So, Dan, thank you very much. I know you put a huge amount of effort to make sure that we can be kept up to date, and you've not disappointed again today. Thank you very much.
Thanks, Aresh.
Right, brilliant. Emma, welcome. We are super excited that you've joined us.
And I'm super excited to be here.
Oh, brilliant. Well, that's good. Now, Emma, you're the Director of Allied Health at CAHS. Tell us, can I just start? Tell me a bit about yourself, and then we'll talk a bit about Allied Health.
Sure. So I always loved working with kids, but I never quite knew what I wanted to do. And so when I finished school, I did law and science, fell in love with psychology, worked as a psychologist for a little while in early intervention with autism, then went back and did OT because one degree is never enough. And I think once you start working in allied health, you realise how interesting all the other areas are as well. And so became an OT and worked in community paediatrics for about 10 years. But I felt like I was treating children's disability rather than treating children as children. And so I wanted to get some developmental experience to, I suppose, enhance the quality of care I was giving kids. So I left a permanent senior position with the Cerebral Palsy Association at the time and came across to CAHS for a 3-month P1 OT contract to get some developmental experience in CDS, and just kind of fell in love with CAHS and the organisation and the work that they do. And I had so many opportunities here, and I just never left. So I've been here for 12 years now.
That's incredible. If you add all those years and see Emma, the two seem incompatible, because you look super young, and that's. I hope that doesn't sound like a condescending statement.
No, I'll take that. I'm in my 40s now. I'm very happy for those comments.
Okay, and the interesting thing, you quite right, to 1 degree is never enough, but actually allied health is a very, very broad church. Is that not right? I mean, a huge number of professional groups, craft groups, fall under that umbrella?
Absolutely. So, I mean, one of the questions I was given as a potential question for today is what is allied health, which you would think as the Director of Allied Health that would be an easy question to answer. But actually, it is incredibly complex. It is an umbrella term, really, that captures a whole raft of allied health and health sciences professions. Each one is absolutely unique. Each one requires 3 to 6 years of tertiary training. A lot of them require additional on-the-job supervision, exams, additional accreditation or training requirements. So I think at CAHS we have 23 professions that fall under that umbrella, and about 450 FTE across 7 divisions actually, because all 6 divisions, plus there's also some sitting under the EDMS. So it is incredibly diverse.
It is incredibly diverse. I'm just interested, how do we raise the profile of and the impact of allied health? Because, I mean, with that scale of diversity, I'm always interested in how children get to hear about it and then choose it as a career. I mean, what made you go into it?
I always loved paediatrics. I've always, even as a child, I was always drawn to helping other kids at school. So I suppose that was always my interest area. But I do think it's a challenge. And I think for many allied health professions, paediatrics is a really small subset of that as well. So I think perhaps the approach might be for CAHS to look at promoting paediatrics as an area to work in, and then giving people a taster of all the different kinds of jobs that you can do within that. Because I think a lot of people actually want to work in peds and then choose the job from there rather than choosing a job and then falling into peds.
Yeah, so the passion that sits with children and families in the first instance.
I think for a lot of people it does. Maybe that's me extrapolating my own feelings, but I do think that for a lot of people they're paediatric clinicians first and foremost, and they find something to do in that field that suits them.
No, I think you're spot on. I mean, definitely if we go back to the various surveys we've used as one of the tools, that alignment around children and families is something that defines everyone within the organisation. We're different in other ways. Now, it's interesting because the impact, I think, of allied health is increasingly recognised, and there's the work that the professional craft group does with children and families, but there is this managerial element, and you're taking a secondment, so which I have to say, it says it's exciting. I'm super depressed about, because you're going to be outside CAHS for a while. Is that right?
Yes, but it's only 3.5 weeks, and I am very confident that those who are covering for me will do a wonderful job. But I've been asked to go and cover the Chief Allied Health Officer at the Department of Health for 3.5 weeks, which it is an exciting opportunity, I think, for CAHS, because they've never filled that job from outside before. So I think it's a really great opportunity for us to get an insight into what happens in that space. There's a whole range of projects happening in that office around both allied health professional governance, but also the National Disability Insurance Scheme, because that office is the lead for WA Health in that space. And so I'm really keen to see how we can get a paediatric flavour injected into the work that they're doing, because usually the system is so adult focused. So for me, it really is a chance to kind of peek behind the curtain and see how we can influence in that space more broadly long term.
No, absolutely, and you're an absolute star, and what a brilliant ambassador to be working in the department. Can I just pick up on one theme? I just wondered whether you'd mind just reflecting a bit more about the impact of NDIS on our children and families. I mean, is that something you feel comfortable doing? Because there's certainly what one would describe as a lot of noise around it, and
Absolutely.
It'd just be good to hear.
I mean, I think there's a few things really. I mean, I think NDIS is an enormous opportunity. It provides the scheme provides families and kids with an amazing amount of flexibility in terms of the supports that they get, and being able to really cater them to their individual needs and make sure that they get the best possible outcomes for their kids. It does rely on parents navigating a really complex system, and it also relies on providers out in the community having the skills to then deliver what the parents are wanting to purchase from them. So I think we are in a bit of a tricky transition phase at the moment, but I think that the potential is enormous and we just need to keep driving the market to build up capacity to be more responsive to families, and then help families learn the language they need to use to get what they need. So I actually think it's a wonderful initiative, but it's just sort of in those early phases, it'll be a bit tricky.
Okay, and do you think there are people who are at the moment missing out on both the old and the new scheme as a consequence of this learning process?
I suppose to be really honest, and I suppose I've come from that sector, so I feel like I can probably comment on this. People always miss out. You know, there's always a cohort of society who've got a lot of other things going on, and life is really tricky for, and I think that's a responsibility for all of us to think about how we can support those families better. But I don't feel as though it's necessarily worse now. It's probably more visible now.
Look, Emma, again, spoken with such passion and clarity, and that's why you are such a brilliant ambassador for the profession and for CAHS. Thanks ever so much for giving up a bit of your time, and I think we're just going to touch base with some colleagues. So, brilliant.
Absolutely. Thank you.
Chris, welcome.
Thanks, Aresh.
Now, Chris Ade, you're the senior respiratory scientist, is that right?
That's right.
Brilliant. Now, I have I've been told, and you've heard it explicitly from Beck, I have 4 rapid questions. Could you tell us who you are and what you do? Yes.
Yep, so I'm Chris Ade. I'm the senior respiratory scientist in the Respiratory Function Lab. So we're the group that does the lung function testing and runs the home oxygen program for the paediatric service in WA.
And can I ask you, how did you come about working at CAHS?
So I was working in New Zealand and started doing a graduate certificate in paediatrics, respiratory science through UWA that was run through CAHS, and ended up having an opportunity to come and work in what would be the leading respiratory group for paediatrics in Australia and if not the world.
No, do you know what, that's fantastic. I absolutely agree with you. I think the global impact of the work that you do and the team do is absolutely incredible. Can I ask you, how does your role fit into that journey, the child's journey, which you've just talked about?
Yep, so as a health science, we kind of fit throughout the entire journey. So for the lung function, we're there for diagnosis, through monitoring of the disease progression or treatment, and then also we're there for the home oxygen program from the day that neonates that go home with home oxygen get to go home, right through to the palliative care service and allowing children to go home in comfort with home oxygen to allow the parents to have some peace at the end of life.
Thank you. And can I ask, is there a bit of your job that you find most rewarding?
So I enjoy giving the patients and the family the clarity, so either the diagnosis of what's happening with them or the good news when they're getting some improvement with their treatment. So it's always a positive impact where you see the glow and smile on their face when they actually see that they're getting better. And
Chris, you're a very modest gentleman, because we were having a chat before and we were talking about everyone's exciting weekend, and actually you're giving up your weekend to upskill others. Is that right?
Yeah, so we've got a spirometry training course that's going on through with CFWA, so teaching some of the remote and regional allied health professionals how to perform acceptable spirometry in the community to help patients stay closer to home instead of having to come all the way to Perth for treatment.
That's fantastic. And can I ask you, I've got 2 more questions. I know it's 4 rapid fire. One is, how long have you been at CAHS for?
So it's just ticked over the 10-year mark for CAHS.
Oh, right. Oh, well, congratulations. How exciting is that? And thank you for everything you do. And then number 5, this is number 6 or 7, actually. What is your favourite biscuit? We've had a competition about this, so we're interested.
It's a little controversial. It would be a mint slice.
Oh, we've not had that before. That's and you're wearing a green top, so that's very aligned. Chris, thank you ever so much. Fantastic work. Brilliant, passionate advocate for the service. Thank you.
Thanks, Aresh.
Now, we're going to carry on with Rapid. Now, Bobbie, welcome.
Thank you.
So, Bobbie Kavanagh, senior speech pathologist at CAMHS. Now, yes. Do you mind? I'm going to touch on your personal life, because you said you were very sore. You've taken up exercise.
Yes, I have. I've started the HBF family fitness sessions and discovered that I'm very unfit, and as is my husband.
But the kids are okay?
Oh, the kids, yeah, they smash it.
Do they?
Yeah.
Is there an internal competition between you and your husband, or not?
Not really. We're just struggling to survive and breathe.
That's very honest.
Yeah.
Can I just, Bobbie, I mentioned that you're a senior speech pathologist. What is that?
Yeah, so in terms of, I guess, young people who come to CAMHS and CAHS generally, often kids that come with mental health difficulties have associated language and communication difficulties. So I guess my job on the team is kind of to work out whether or not they've got underlying language or disorder or communication difficulties that are impacting on their emotional well-being. That's part of, obviously, comprehensive team assessment that we do at CAMHS. And then, obviously, we can work together to look at kind of functional goals for that young person or child's recovery.
And sort of out of the children who attend CAMHS or your service as a whole, what is it? Do you know what kind of percentage actually require the speech pathologist to take part as well in the journey?
Actually, that's a really good question, because
massive numbers actually have language difficulties or unidentified language difficulties, often leading to literacy difficulties. And surprisingly, often in CAMHS we'll meet children in upper primary and high school who've gone on and on and on and had unidentified language and communication difficulties, and maybe have written off in the classroom, say, as the naughty children or the very emotional children that can't kind of manage their behaviour. So the latest research is showing probably between 50 to 70% that present at child and adolescent mental health services, which is massive.
Can I just pick that up, because it's interesting, obviously, quite rightly, the amazing work of CAMHS has bubbled up and really been brought into the spotlight as a consequence of COVID.
Yes.
And you were I was interested in the age group that you're talking about, because the spotlight has been very much on those teenage years, the 12, 13-year-olds and up. But I don't know, from what you were describing, I got the impression you might be talking about a slightly younger age group.
No, my role I guess, and everyone's role in the team encompasses probably working with kids mainly between the ages of, say, 8 and 9 right up to 17, 18. We occasionally get the younger ones through. Often, the work with those younger ones will be primarily with the caregivers.
Yes.
But yes, there definitely has been a bit of a surge, I guess, in some of the kind of later primary adolescent kind of cohort since COVID. And that's probably what we're managing more as a priority at this point. But usually we we see all ages.
And is there a bit that you really, I know you love your entire job, but is there a bit that you really find very rewarding?
I think probably first and foremost, I think similar to what Emma said, I've always been drawn to kind of working with children, but I also particularly like working with adolescents, and the fact I get to work with all ages is actually unique for a speechy. But also I work with a very good team of very skilled professionals at Bentley CAMHS, or Bentley Family Clinic as we're known as, and that makes my job lovely every day to actually work with them.
Thank you ever so much for recognising teamwork, and I agree.
Yeah.
I won't isolate any one CAMHS team, because I think you're quite right. We have a fabulous group of staff, but your immediate team is amazing as well.
Thank you.
Absolutely amazing. So thank you to them as well. And now I will end on another important question. And you've been given forewarning about your favourite biscuit, and I don't know whether your children provided you any guidance or you're autonomous in this decision.
This is actually a very hard question, because my mum's Italian, so I've been made varieties of biscuits since birth.
Yes.
But I think I've sort of narrowed down to maybe the almond shortbreads that only Nonna can make, the ones that have the kind of icing sugar sprinkled on top.
Oh, wow. Okay,
Delicious.
well, that's we're not that posh here normally, but so you'll be joining the elite. When you said Italian, I imagine Garibaldi. Are they Italian biscuits or no? Everyone's looking. Garibaldi biscuits?
Not sure.
Oh, well, we'll have to get a dictionary. They're not sponge. They're hard crust with a soft centre. No, okay.
Sure.
We'll come back. Look, Bobbie, I don't want that to detract, a silly end question to detract for the amazing work that you do and the advocacy that you've provided today. And really, I also want to acknowledge the real stresses that CAMHS has been facing in terms of the number of children they've been caring for. So I want to celebrate you and your profession and your craft group and CAMHS today, and thank you for coming and providing such an eloquent description of the service.
Thank you so much.
Thank you very much. Have a lovely weekend and enjoy the HBF. Lauren, we met earlier. How are you?
We sure did. I'm well. How are you?
Well, I don't know how you're feeling, actually, because Bobbie said she's going to go and do exercise all weekend, and you told me you were going to do nothing. So I don't know how you're feeling.
Well, I'm usually pretty fit during the week, so this weekend I'll put my feet up and do
It's going to be relaxed.
Yeah.
So maybe we could just reflect on the work during the week. So you manage the Orthotics service, is that right?
Yeah, I'm currently acting manager of the Orthotics services. So in Orthotics, we manufacture and fit and prescribe orthoses or braces to our paediatrics who need braces for things like fracture management or protective orthoses or things for their mobility. So,
I mean, is the range of orthotics that's used for children very, very different to that to adults?
Well, yes, because we see kids when they're babies, so fitting braces for hip dysplasia, but right up to we also fit braces that adults can wear as well, so ankle foot orthoses and spinal braces and things like that.
A huge range. So can I ask, how do you normally get involved in the treatment of a child? How does that happen, come about?
Yep. So well, we receive a lot of referrals from orthopaedics. We receive referrals from CDS, all sorts of areas, but mainly from orthopaedics. Say a patient has fractured their arm, they need to come up for a wrist brace, things like that.
And can I ask you, it sounds when there's sort of hard material involved or soft material involved, we think of technology. I mean, I imagine orthotics has changed amazingly over the years. How is it in 2020?
Yeah, it's continually advancing at a really, really fast rate. At the moment, we're currently doing a research project looking into how to implement 3D printed orthoses into our service, which is a really, really exciting area and something that every single team member in our team is really excited about. So, watch this space.
And will you be looking at, so that becomes very bespoke, is that right? Because will you scan and then be able to create something that's a perfect fit?
Yeah, pretty much. We're 3D scanning now. But at the moment we get it milled into basically like a foam shape, and then we drape the plastic over that foam shape to make the plastic brace. Whereas 3D printing an orthosis will basically take away all of that foam, which is amazing. Yeah.
It does sound amazing. Can I just wondered, I'm doing your questions in reverse. It's an unusual specialty to go into. I don't know how many people know it exists, for example.
Yeah.
How did you get into orthotics?
Originally, I wanted to work in a physiotherapy or rehab space, but kind of just came across it. And the course is actually only in Melbourne, so I'm originally from there. And yeah, as I just fell across it basically and really took an interest into it.
And it sounds like it's a great mix of a bit of physics and technology and material science, biomechanics. That's absolutely incredible. I have to ask you this. I mean, having talked about the range of ages and bespoke material that you craft for children, which is the bit that you find most rewarding?
Probably, so I find two things rewarding. So being able to fit something to a patient and watching them do something that they weren't able to do before. So, for example, fitting a post-operative brace and watching them walk or watching them get up out of bed, that's really, really rewarding. But also just working with an amazing team. We only have a team, there's 6 of us, and they're just incredible and fully flexible and love working with kids, so it's great.
Well, look, I actually we do get to hear about everyone's work, just in case I've put my foot in it. But I know that Emma has been talking about the 3D work and advocating for the space and technology. And obviously we also visibly see your work often either in the community or here. Not always, because some of it's so carefully crafted. So thank you very much for the transformation you're driving, both within the organisation and recognising your team and the incredible work they do. Now it comes to this killer question. Favourite biscuit?
I would have to say a caramel Tim Tam.
Oh, yeah.
It's
You've got a
life-changing.
bit of approval? They're very bespoke, these. Yep. I'm going to write that down. I don't know why, but you've made me write down the caramel Tim Tam. Can I thank you and your team, and again, thank you for the eloquence with which you've advocated for your craft group. It's been amazing, and I hope you have a lovely weekend. And thank you for the work that you do.
Thanks, Aresh.
You're fabulous. Oh, now this is. Hi, is that Mitch?
Hi.
Hi. Yes, someone's giving me. How are you, Mitch?
I'm very well. How are you?
Now, Mitch, I've got a highlight. One is I seem to be shouting, and I've been told to turn my voice down. But you aren't actually in the studio. You're one of our call-in technology people.
Yes.
That's badly articulated.
From West Perth.
So, Mitch, you're the coordinator of physiotherapy in community health. Is that right?
Yes, I'm the coordinator at Clarkson Child Development Service.
Oh, right. Actually, quite a way out of the centre of Perth, and I know that that actually the commute in for children represents a real challenge. Does that change the way that you the range of services that you provide as a consequence?
I think so. I guess we sort of do sort of see that some kids are, and I guess families are a little bit more disconnected from, I guess, that more so tertiary health service, and I guess that sort of makes us a bit more of that sort of front line and sort of first sort of contact for a lot of families and things.
And can I ask you, it's interesting because we throw these terms around, but I wonder whether you could just reflect on what a physiotherapist does.
I guess my role as a physio, I guess in community health within CAHS, is to work with kids sort of from ages 0 all the way up until they're sort of 12 years old, I guess, around any kids with sort of developmental delay or sort of gross motor delays and things throughout sort of their childhood, as well as we work with kids with sort of like plagiocephaly and things like that in that sort of in real infancy, and as well, I guess, sort of that point of sort of referral for a lot of kids if they're sort of being seen in community and sort of need sort of further investigations sort of higher up at sort of either PCH or with our paediatricians out here as well.
And can I ask, how did you get to choose physiotherapy as a career, and then how did you come to work at CAHS?
I guess that's kind of rolled into the same answer. I myself have cerebral palsy, so I was sort of a child of PMH for a very long time and sort of was within, I guess, what was before CAHS in community health, seeing a physio. My physio when I was a kid still works for Child Development Service, so I guess that sort of very much directed me towards physio, and sort of people like Sarah Love and Kate Langdon were always very sort of like, oh, you'll probably become a physio, and I always denied it, and then I ended up becoming one, and then I guess I always wanted to work with kids and I guess sort of give back in that sort of way, and yeah, that's how I sort of came to work in CDS, and I love it.
Mitch, that is actually, I don't know how in such a small number of words and sentences you can be so inspiring, but that's actually fantastic. Learning about that journey is absolutely incredible. I'm always fascinated to know how many people have been inspired through events in their own childhood to take up the profession to which they're exposed. But that's so beautifully articulated. And thank you very much for celebrating those with whom you've been involved with over the years. I mean, I just wondered whether you could just reflect on, having looked at the breadth of work you do, what the bit that you find most rewarding.
I think definitely for me, working with kids sort of in that sort of 12 to 24 months like age range that have sort of come in around, you know, gross motor delays of sort of not walking and things, and then sort of working with them and their families and sort of getting to this point where they're walking and running, and like their parents' sort of whole sort of attitude and things towards their kids just like changes so much once they've sort of, you know, put in all this work to get them walking. It's always so exciting to sort of see those kids like walking for the first time after you've put a huge amount of work in, especially if, you know, they've come in with like sort of concerns or their parents are quite worried about sort of that delay and things. I think that's definitely the thing that's the most exciting and the most fun.
And can I ask you, has the mobile phone changed that? I mean, do you find parents are filming what's happening at home and bring it to you and as to help the diagnostic process or even the celebration process?
Yeah, definitely. Like, yeah, I've definitely had a few parents being like, oh, like, you know, they might not be doing this today, but, oh, they were doing this at home and, you know, showing us sort of walking and things like that. Or, you know, they'll even sort of, you know, send pictures and stuff if they're sort of emailing things just to be like, oh, like, look what they're doing or, you know, how well they're doing it. It's always really nice to see that, and it always makes us pretty happy to see those things.
And can I ask you, we've got, your title's longer than just physiotherapy. It's got coordinator of physiotherapy. What does that coordinator role involve?
It's basically like a senior physiotherapist at sort of one of our community health sites. So it's more of sort of that, that higher sort of clinical role. It doesn't really sort of change what I do, but I guess the role sort of becomes a little bit more administrative, and sort of like supervising sort of junior physios, as well. And I guess sort of being that more sort of clinical sort of lead for physios at each site, and things.
I love hearing the word administration. That's what excites me most. What I just wanted to do is, look, having chatted to you, I have absolutely no doubt that you yourself will be inspiring the next generation. So thank you for the work that you do up in Clarkson, but I know that today you are the voice of allied health and physiotherapy right across the service. So it's great to be able to see actually the range. Emma talked about the 23 allied health professional craft groups that we have within CAHS. So it's not just within PCH that we're talking. This is genuine CAHS-wide impact for children and families. So thank you very much. You've been super articulate and inspiring in your reflections. Can I just ask you this question as well? Even though you're up in Clarkson, I presume you like biscuits.
Yes, of course.
And are you willing to share which one?
I've got to say the definite favourite would have to be like the Monte Carlos.
Oh my goodness, I've never even heard of a Monte Carlo. Oh, yeah. Oh, we've got someone else who has a favourite. I think I'm going to make sure that we have a display on the website of the various biscuits available for people to eat. No, we're not allowed that because it's actually it's not healthy. But you don't eat them, do you? You just like the idea of them.
Oh, of course. I only like the idea.
Mitch, thank you ever so much for taking time out. Thank you for sharing your work and your passion with us. And please pass our gratitude to all your colleagues as well.
Thanks a lot, Aresh.
Have a lovely weekend, Mitch. Take care of yourself.
You too.
Cheers.
Bye.
Call now on 6456 5629 or 0436 595 600 to ask a question.
Beck, welcome. You told me that we've got some questions. Is that right, or a question at least?
I have a question for you,
Okay.
Aresh. Will there be any changes to the current restrictions at CAHS with the reopening of the borders, which we just spoke about?
We did. I suppose it's an interesting one because I just want to re-emphasise what Dan said. There is going to be a change. The borders are opening, and I think no matter what we say, there is complacency that comes with a sense of safety. And we have definitely been in a very safe place. And I'm not suggesting we're not going to be in a safe place, but what we have to do is remain vigilant. So we are going to be very strong in our message around adherence to the principles that we have been advocating since we have become aware of COVID and its impact. So social distancing, physical distancing really means physical distancing. For us, for example, if I was to take the example of PCH, 4 people in a lift is a pretty clear message. We really want 4 people in a lift. Physical distancing really does mean physical distancing. Ensuring that we're compliant with hand hygiene means we should be compliant with hand hygiene, keeping our environment clean, and actually re-emphasising the need for people who feel unwell not to feel guilty about staying away and keeping children, families and colleagues safe. And last but not least, those simple measures such as coughing into elbows. So no, in many ways it doesn't mean anything new, but it does mean a reinvigoration of our commitment to those very basic principles. So please don't be embarrassed to challenge. You may well be saving a life if you do so. So let's embrace the opening of the borders and the sense of freedom that brings, but let's remain vigilant and not complacent. Brilliant. Thank you. Now, I will finish because I think the one person I've not asked today about their favourite biscuit is, again, our Director of Allied Health, Emma, yes. So you've had lots of time to think, and that doesn't put any pressure on the type of biscuit, but why don't we finish on a positive and a biscuit, your choice as Director of Allied Health?
Just to be clear, I don't need time to think. I bake the world's most amazing tahini and choc chip cookies, and there is no packaged biscuit that comes close.
Oh
That's
my goodness,
response.
that is really taking the fight to the ring. That's fantastic. Well, is there any chance that we will be able to taste those tahini biscuits?
Well, you just never know your luck.
Okay. Well, look,
I'm holding up for the bake-off.
We wanted hope at the end of this radio show, and you have provided
Christmas
it.
bake-off.
Christmas bake-off, the tahini biscuits.
Tahini choc chip.
Tahini choc chip. Okay, that's fantastic. I'm a bit embarrassed, actually. I know what tahini is, but I'm not sure if that's possible to know and not know. Well,
It's
look,
a sunflower seed paste, if that makes you feel better.
that's exactly what I was just about to say.
Actually, I lied, it's sesame seed.
Sesame seed, okay. So, look, can I once again thank Dan for his amazingly articulate reflections of what science is teaching us about COVID. Chris O'Day for the amazing work he does with the respiratory team as a senior respiratory scientist. Bobbie Kavanagh, the senior speech pathologist with CAMHS, and the work at Bentley. Lauren Bell with the Orthotics, and Mitch up in Clarkson as coordinator of physiotherapy. Emma, you have such a huge amount to be proud of. We at CAHS have such a huge amount to be proud of and be thankful for. I wish you a very happy Allied Health Week, and we will continue to celebrate the team each and every day. Have a lovely weekend.
Thank you.
And I'd like to thank all staff for the contribution they make each and every day to the care of children and families, and look forward to chatting in 2 weeks' time.
Welcome to Radio CAHS, presented by CAHS Chief Executive Dr. Aresh Anwar. Welcome to Radio